Kathy Kress again, and I'm back with my new Geriatric Care Management YouTube channel. It's different than my sibling channel, and it's all based on my new My Geriatric Care Management Agency Operations Manual, which you can get on my website, kathykress.com, and it is in an electronic version that can be downloaded with 150 forms that you can use. So you can run a geriatric care management agency, and if you look back, I describe it very much like McDonald's, because that's what McDonald's does. Their manual is called How to Fry the Hamburger. So we are dealing with this Lebanese gentleman, Mr. Hayek, and he is, we've already gone through 6 other parts, and I said 4 parts are really critical to get a psychosocial assessment, but we're covering a couple more parts that I think are really important and are in the health assessment that is in the manual. It's about 6 pages long, but it prompts you for every question that you need to ask, so you don't really have to worry about it. It will be here. And the second, this part is about substance abuse, and substance abuse is pretty dramatic among the elderly, mostly because, and the elderly I'm talking about, well, I'm elderly, I'm 67, but, you know, among, say, the greatest generation, because, you know, even though there's a resurgence in cocktails, everybody's into cocktails now. Well, cocktails and cocktail hour was a normal part of their lives, and 49%, it's almost 50% of older people, say people over 85, have a cocktail every day on some regular basis. But not everybody abuses that. Only 10% of the elderly really have problems with alcohol. So there's this great test, and I find it funny. It's called CAGE that you can use, and it's in the manual. You know, to find out. You're really probably not going to find out the truth, because people who have alcohol problems, do they tell you the truth? No. So this is just a way you can get it. And CAGE only has 4 questions. It's self-reporting, and you can even download it. And it starts with C for CAGE, and that's have you cut down on your drinking? And then it goes on to A. Do people annoy you when they ask you about your drinking? You may be annoying them by asking this. G, CAGE, guilty. Do you feel guilty about your drinking? And E, do you need an eye-opener in the morning? My favorite question. Now, most of the time they probably aren't going to tell you the truth about this, but maybe they will. The bigger problem with older people is prescription drug abuse, because older people take so many more medications than younger people, because they have chronic illnesses, and they become addicted to legal drugs. And 37% of older people have prescription drug abuse problems. So it's a pretty widespread. And I'm going to post on my my blog, some of this information, because it's, there are a lot of ways that you can track this. But one is, it's called doctor shopping. Older people will go to 2 or more doctors and get them to prescribe the same medication, and it's mainly because, I'm not going to go into this, but I love the VA. The VA has this computer system, and it's had it forever, where you can just look into the computer and you can see every drug, every year that person has been involved. And so, drug abuse in the VA, they can see it right away. But we all go to these different practices, so it's really easy for an older person to go to one doctor and the other, and nobody knows the difference. And the other thing is to have 2 pharmacies. So there's a whole bunch of that, and I'm going to put that on my blog. And there are 2 kinds of meds that older people really get in trouble with. And I'm not a nurse, but I'm going to do my best to describe this word, pronounce it, opiates, I think that's right. but that's painkillers, and older people take painkillers a lot, and that would be like OxyContin. I hope you've heard of that. It's very, I find, a very dangerous drug. Percocet. You've taken it for dental pain. Sometimes people stash it. Vicodin. We've all taken that for dental pain or some sort of pain. But it's one of the most, that whole group is one of the most common overused and illegally kind of abused drug with older people. The second I'm going to have a harder time pronouncing, but I'll give it a try. It's benzodiazepines. I hope that's right. And this is for anxiety. And, you know, I talked about this older person. He had been, you know, widowed. He had been married for 60 years. He's living by himself. He's depressed. He has a right to be depressed. That's normal. Older people have a lot of anxiety and a lot of depression because they're facing death. And then they have, you know, they lose all of their siblings, all of the people that have shared memory with them. And so normally they take these meds, but they overuse them. And these are things like Valium, Xanax, Klonopin, and Ativan. So the older person that we're dealing with, this older Lebanese gentleman, he doesn't have any of these problems. We've gone through all that. In fact, he won't even take his meds. His son goes over every week to set them up, and he's not taking them. A big problem there. So that's a medication problem. So I will see you next week or the next time you watch this, and you can go to my website, kathykress.com, and I will look forward to seeing you next time.